This is One-on-One. We are pleased to welcome Dr. Jaya Srinivasan, who is Chief Pediatric Rheumatology at St. Joseph's Children's Hospital. Good to see you.
Thank you for having me.
We've had these conversations off the air. We're actually doing a seminar talking about actually medical communication for physicians and how challenging it is sometimes to talk about clinical issues to a non-clinical audience. And one of the first questions I asked you in a seminar was, what's the difference between juvenile arthritis and arthritis in an adult? Help folks understand that.
Well, when patients or parents come to me and they bring their child for joint pains, or when anyone hears about it, they say, what, kids can get arthritis? Because
Which I didn't know, by the way.
When they think of arthritis, they think of their grandparents having arthritis and people walking around with canes and wheelchairs and people in their 80s, not 2-year-olds. So the main difference is that the arthritis that you see in your grandparents is not the same that you see in children. But
what is it in children?
So in children, arthritis is basically when you get swelling and difficulty moving your joints, and it's basically inflammation in the specific joints that are affected.
How would you diagnose it?
There's no blood test, there's no imaging or anything that is specific for arthritis. You have to take a very, very thorough history and do a full physical exam where you're checking every single joint. When someone comes to my office, I check every single joint. Even if they're only complaining about their knees, I check their fingers, their neck, their back, because they may not necessarily notice, and you look to see how well these joints move. You look to see if there's fluid within the joint, and it takes several years of training and practice to really be able to examine and figure if someone has arthritis.
But doctor, you know what's so fascinating about this? First, there's a couple things. One, there are only 300 doctors, physicians who do what you do in the country, and you just said before we got on the air, there are some states that don't even have any.
Right.
Why is that?
Well, it's the conditions that pediatric rheumatologists deal with are very rare conditions. And even though that they're rare, the fact that we only have approximately 300 pediatric rheumatologists, the demand is definitely there. And since these are very rare conditions, it wasn't really well known previously, and there weren't as many patients who had it. So people really weren't going into the field.
Where do they go, though? So say someone, here's what's confusing to me. A child isn't going to be able very often to communicate or say, well, I think I need to see a pediatric rheumatologist. So it's the parent who's now the advocate for the child. What should the parent be looking for?
Well, the parent would take their child to the pediatrician, and the pediatrician would help and be that segue to help them and decide whether they need to see a pediatric rheumatologist or not.
Are most pediatricians looking for the right things?
Well, some of the things, since these conditions are really not seen as frequently, though it is increasing over time and the awareness is increasing over time, they often are not sure when children come to them with joint pains of whether this is arthritis or if it's just general.
I'm sorry for interrupting. We're looking right up here. Because very often I have to hear you tell you something. Our boys are 11 and 12 as we do this program, a big boy turning 13. The term growing pains comes up constantly. I have to tell you, almost as a euphemism for everything that happens. And now you've got me thinking about this. Talk about these.
Right. So growing pains is very common. Up to 40% of kids have growing pains. So what makes arthritis different from growing pains is there's certain symptoms that patients will come into their doctor. Now, if you're having pains here and there or pains after you exercise, it's not the same sort of pains that you might get with arthritis. Children who have these pains, it's pains that are occurring almost every day.
So that's persistent.
Persistent.
Good. Put that back up, team, again. Put it back up, Bob. And then swelling of the joints. So there's really swelling.
Right. And again, they may not necessarily notice the swelling, but if parents do notice it, this is something that should, key in their minds that they should go to their pediatrician.
You wake up in the morning, joint pain or stiffness on a regular basis. Hey, that's not normal.
No, it's not normal because it's different. Growing pains, you may have pains worse at the end of the day.
Not in the morning.
Not typically in the morning.
And limping?
Limping is one of those that, along with the stiffness that you feel in the morning, they may limp, they may not be able to straighten their legs as well. So if you see any of these symptoms, the parent should take their child to the pediatrician.
And the last one, change or limitations in daily activities. Talk about that.
So a lot of times when parents come to the doctor, it's not specifically because the kid is complaining of pains. Parents may notice that there are changes in activities of their children. For example, I had a patient who was a baseball player. He was, I think, 10 years old, and he was a baseball player. He was still playing, running the bases, but something that he noticed differently, or his parents noticed, is that he was running slower than he used to. And when I examined him, he had arthritis or big swollen joints, but he really didn't notice it. He was able to still play, but the thing he really noticed is that it was slowing him down.
At 10?
Yes.
How do you treat it?
There are many different types that fall in that category of juvenile arthritis, so it really depends on what type it is. And there are different medications, starting from medicines like ibuprofen that help with it, and then there's a lot more aggressive treatment as well, some medications called biologic agents.
Are we better than we were at this?
We are much
10,
better.
15 years ago?
If you went back 20, 30 years ago, there were many children who had to be in wheelchairs. There were children who needed joint replacements. Right now, it's more of a norm that children do better than it was 20 years ago.
So no reason to freak out with the diagnosis?
No reason to freak out. They should
be concerned, yes.
Yes, should be concerned and should get to a pediatric rheumatologist as soon as possible, because the earlier we treat it and the more aggressively we treat it, it can help and it could prevent complications.
You love what you do.
I do.
Because?
Because I'm dealing with great patients all the time. I can make a difference, and children can live full, healthy lives if they're treated early and aggressively.
Dr. I want to thank you and your colleagues at St. Joseph's for sharing important information, particularly about a topic, juvenile arthritis, that not a lot of people understand. Thank you, doctor.
Thank you.
Stay right there. We'll be right back, right after this.
One-on-One with Steve Adubato has been a production of the CAUCUS Educational Corporation, celebrating over 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by MAGNACARE, New Jersey Resources, Bloomfield College, Wells Fargo, Johnson & Johnson, New Jersey Sharing Network, and by Choose New Jersey. Promotional support provided by NJ.com, Small News, Big News, True Jersey. And by New Jersey Monthly, the magazine of the Garden State, available at newsstands. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.